who are talking about wellness and innovation. So wonderful to have you both on the program. Dr. Shavin Gopal, Head of Public Observatory, and Dr. Fleur Tam Noel, Primary Care Physician. Good morning. Good morning.
Morning.
Welcome, welcome. So we're talking about wellness and innovation, and this is on behalf of the North Central Regional Health Authority. Tell us, I'm going to start with you, Doctor. Tell us what it's all about.
Sure. So next week, Thursday, the 31st of October, we'll be having a research day, and it's a combination of the first part will be research-oriented, and the other part will be a festival. So the first part, research and innovation for better health outcomes. It'll be an opportunity to hear 7 presentations, research done in Trinidad and Tobago, and also view 20 poster presentations, and those will be judged and prizes given out after.
And I know in the academic world, a poster is extremely significant and very important, because it has all the information with regard to the research captured in one space.
Of course. So that starts at 8, from 8 a.m. to 1:30 p.m. And although it's academic, we're really making sure we're pitching it at a level where everyone can understand, public and also academics. And then from 1 p.m. till 6 p.m. in actually building 2, which is close to the main lobby, the main lobby at Eric Williams Medical Sciences Complex, we'll be having a Wellness and Innovation Festival, where we'll be providing opportunity for screening for all members of the public, screening in terms of blood pressure. People can have their blood sugars done, their weight, body mass index checked. They also have opportunity to have dental checks, opportunity to have a pap smear if they wanted.
Where is this going to be?
At Eric Williams Medical Sciences Complex in building 2, that's the main lobby, next week Thursday from 1 till 6 p.m. And we'll also have services, specialist services, information booths. So if they need to talk to a mental health specialist, if they need to talk to a lung specialist, a urologist related to prostates, gastroenterologists, ear, nose and throat, surgeons, even skin specialists, there's an opportunity to actually access that information.
I now understand the word festival.
Yes.
It's a complete... Why is it important to have this event, Dr. Shavin Gopal? Why is it important?
Well, you see, one of the problems that we tend to have in Trinidad and Tobago is that we have a high rise of terms of chronic diseases. So when we use the word chronic disease, we see a set of high prevalence as it relates to diabetes and hypertension. So one of the basic and modern ways in public health is screening. So in order to circumvent or kind of curtail what we see in the high amount of chronic diseases, is that this screening practice will help us bring down the numbers. So it is quite important for us to screen Joe public and get an idea of persons to know their numbers. So simple things like blood pressure, glucose, even knowing for women for pap smear and breast examination. As you may know, this month is the month for breast cancer awareness. So at NCRHA, we took that in mind and designed this wellness festival that we're having, both women and men in mind. One of the things we see happening at the WHO and PAHO results in 2018, we're seeing that there are a high number of cancer cases among men. And you know, as women, you tend to see a high amount of uterine cancer, breast cancer, men, prostate cancer, and lung cancer. So having said that, it is very pertinent for us to have these screening programs. And as Dr. Tam said, it will be occurring on Thursday between 1 to 6. And the difference between this Wellness Innovation Festival as compared to others is that we're going to have engaging with specialists. So you could come along and you could talk to the primary care doctors, and also you could engage a dermatologist, gastroenterologist.
You think you're going to have enough?
Of course, at NCRHA we always have enough. You know, we always have enough doctors. We're always ready. We always planned.
Now I see the word innovation being used. So I understand the wellness. And where does innovation come in?
Innovation. What really is valuable to us is that with all these initiatives we're having, is that we want to have better health outcomes, because we know that many people are dying from cancer, and also too the #1 killer in Trinidad is a lot of cardiovascular related diseases like heart attack and stroke and high blood pressure, that sort of thing. So the thing about it, we're seeing how the research that we have implemented is working to help reduce those numbers
the
and
application.
also to prolong life. So this is where the innovation in terms of improving quality of life and improving better outcomes.
And what would be the follow-up? So you inviting the public to come on next week Thursday, 1 to 6 p.m. at the Eric Williams Medical Sciences
Building 2.
Right, Building 2. and you have all of the screening taking place. What is in place thereafter for persons perhaps who may screen and find that they need help? Okay. What's the next step? Okay,
so what we're going to be doing on that specific day, we have decided to fast track certain types of tests. So one, for example, like PSA testing. You will be allowed to get back your PSA testing within 2 hours.
Right.
And if there's any that you are considered red flag or you're critical, we will book you into the St. Joseph Clinic to have follow-up because if it is considered critical.
Okay.
So we will be, it's not that you just come in and we just see you and then you go your merry way.
Yeah.
We are going to book you into a clinic if there is a legitimate concern.
So there's a follow-up process.
There's definitely, there is going to be a follow-up for all patients that attend this Wellness and Innovation Festival.
Okay. And this is an annual event, you said, that happens every year.
It's something that we're planning to continue.
To continue, yes.
And I just wanted to mention one thing with respect to research that will be occurring in Amphitheatre A, whereas the festival will be more towards the main lobby area. So it's 2 different sites, but the first site occurs in Amphitheatre.
Let's talk a little bit about the research. So this research is being done by the doctors who are practicing or by the students, the medical students. Where does the research come from?
Well, we have a wide array of applicants. So it comes from both from students and medical doctors. Now, we do have, as Dr. Tam was saying, we do have a lot of research that have been submitted. It will be characterized both as posters and presentations. So some of the very interesting research that we have coming out, one will be like diabetes, the other is like mental health, and one of very interesting to me is pharmacology and pharmacodynamics.
Right.
So on that day, it's really for not only for the academics to come and attend, but also for Joe public to attend and get information, and they can also use this information in order to gauge the clinician. You know, so usually these research used to be geared to academics, and you used to see the lecturers attending and so forth, but no longer is like that. We're trying to get Joe public to come out and attend, and you know, they could actually make some sort of tangible inferences from the information that they receive. And they could also engage the clinician, as I said in the prelude of the interview.
Well, let's give the information once again. It's next week, Thursday, which I believe is the 31st of October.
That's right.
From 1 to 6 p.m. at the Eric Williams Medical Sciences Complex, Building 2. All right, I want to thank Dr. Shavin Gopal, Head of Public Observatory, and Dr. Fleur Tam Noel, Primary Care Physician from the NCRHA, for being with us on the program this morning. But this takes us all the way up until the 7 o'clock hour, where Dion Batiste Clark is on standby for the news to the top of the hour. Back after that.